So good afternoon to most of you. Morning to those of you in Hawaii and here on the Pacific Coast. This is Eric Bruns. I'm here with April Sather in our offices at the University of Washington in Seattle. For those of you who are interested, yep, it's cloudy, a little bit rainy, and in contrast to any of you on the East Coast right now or in most of the country, it's about 55 degrees outside. So a lovely Seattle day going on. Also want to recognize Sarah Peterson at the Pathways Research and Training Center at Portland State University. She has supported all of the webinars that the National Wraparound Initiative is presenting for the field, and she is helping us out here as well. Sarah, are you unmuted? Can you tell me if I'm coming through and everything is working here?
You sound great, Eric.
All righty. Thanks, Sarah, down in Portland. So this is the third of six planned webinars that the National Wraparound Initiative is doing. I'd like to welcome 55 attendees who are on the webinar on the attendee list with us. This is going to be a webinar about accountability and wraparound. Before we get started, want to make sure that folks have some basic instructions on how to work the webinar. First of all, move electronic handheld devices away from your computers and speakers to have the highest quality sound. Close all file sharing applications, again, to make sure things are as effective as possible on your end. During the presentation, this is important, we want to make this interactive. You can send questions to us here, the webinar organizer Sarah and myself and April. But we will probably hold responses to these questions until the end. We'll review the questions and answer them in the last 20 or 30 minutes of this webinar. But feel free to use the control panel that should be on your screen to ask questions by typing them in to the appropriate box there. At the end, we will be able to get verbal questions as well. During question and answer, you can raise your hand, which should be an option on your control panel if you'd like to verbally ask a question, and then we will unmute your line and take that question from you. Otherwise, we will probably primarily be responding to the typed-in questions at the end. So hopefully that's enough of the working the webinar information for us to get started here. So again, this is webinar number 3 from the National Wraparound Initiative. I am trying to scroll to the next slide. Suddenly, doesn't seem to be working, Sarah. Let's see here. Try this again. Page down. Here we go. Webinar 3, Accountability and Quality Assurance in Wraparound. And let's just launch into this. What we're going to do today is review some key issues to consider in building accountability for a wraparound project, review some types of data that are typically collected. We're going to review some specific instruments to wraparound, including the fidelity measures from the Wraparound Fidelity Assessment System, and hopefully have time for some interaction at the end of the didactic session here. Throughout the webinar, we want people to know, first of all, this webinar will be recorded and you'll have access to all the slides. Sarah, where will folks be able to go to get those? Is that on the National Wraparound Initiative website?
Yes, we'll have it on the homepage of the NWI. There'll be a news item so that you can watch the recording and get the PowerPoint slides after. All
right. So just so folks know, this is part of the effort of the National Wraparound Initiative to serve as a resource to the world around methods, the benefits of and methods to implement the wraparound process for children, youth, and families. And a lot of the materials we'll be going over here today, if not all of them, are available by going to the National Wraparound Initiative's website, nwi.pdx.edu. And we'll also, throughout this webinar, refer you to resources that you can go to for much more information than we'll be able to cover in 1 hour. And one of the sources of that information will be the Resource Guide to Wraparound, which is available at www.wrapinfo.org. You can also go to rapinfo.org to go to the website of the Wraparound Evaluation and Research Team that April Sather is the coordinator of, and that is the mechanism for disseminating the tools of the Wraparound Fidelity Assessment System. Here's a little screenshot of the NWI homepage. It's brand new, and we encourage folks to go there. You will see many, many, many articles and resources, again, many of which will be relevant to the accountability topic that we'll be going over today in our webinar. So go to the NWI website for much more information, and also, just to let you know, some specific resources to the topic of accountability and fidelity and implementation monitoring. If you go to the resource guide to Wraparound, which you can access through the NWI website, you will see an entire section on theory and research of Wraparound that will be part of what we talk about today. In Section 3 of the resource guide, about 6 or 7 articles there, and then over 20 articles in the Section 5 of the resource guide about supporting Wraparound implementation. And as I said, you can go to the Wraparound Evaluation and Research Team website through rapinfo.org and learn more about the fidelity tools we'll be talking about. All right. Here is a screenshot of the resource guide to Wraparound just for posterity's sake. So let's launch into the first goal, which is let's talk a little bit about some of the core principles of how to build an accountable Wraparound program or initiative in your community. So just by way of background, as a lot of folks on this call probably already know, there's an increasing amount of research that shows that Wraparound is associated with positive outcomes for youth with complex needs, complex behavioral health needs, youth who are involved in multiple systems. The best developed research is in the area of maintaining youth in the community and reducing costs of out-of-home placement for communities and programs. We also have a fairly well-developed research base, still needs to grow, about the behavioral and functional outcomes that are associated with Wraparound. And you can see a review of all of these outcomes. We're not going to talk about those today. We talked about them in the first webinar back in March. But you can find lots of details about the evidence base for Wraparound in the theory and research section of the resource guide. What we're going to talk about today instead is how Wraparound implementation quality must be high to achieve positive outcomes. We need to achieve high levels of Wraparound implementation quality at a family level, a team level, and also at a community program or initiative level. One way the National Wraparound Initiative has communicated this need is by describing 3 levels of support for Wraparound. What we like to make sure folks recognize is that effective Wraparound teams that have the potential for positive outcomes for the families and youth who are participating in those teams require supportive organizations as well as hospitable systems, including state systems and contexts. And when we describe what specifically is needed in terms of program and system support, we describe it in terms of 6 themes. First of all, community partnership and collaborative action. Do we, in our Wraparound initiative, have true collaboration across the systems that are important and the stakeholders that are important to these youth and families? Do these stakeholders take concrete steps to translate the philosophy of Wraparound? Do we have fiscal policies that are supportive of Wraparound implementation and that are capable of meeting the needs of the children participating in Wraparound? Do teams have access to the services and supports they need to meet families' needs? The 5th type of program and system support is human resource development. Do we have the right jobs, the right caseloads, and the right working conditions? Are people supported with coaching, training, and supervision? This is where we start getting into today's webinar topic. We believe that individuals who have key roles in Wraparound implementation need to be supported by high-quality coaching, training, and supervision, and data plays a role in ensuring that individuals are getting feedback on how well they're doing their work and being supported to do their work better over time. So the sixth and final type of program and system support that we like to communicate about Wraparound is accountability, really the topic of today's webinar. Do we implement, do we use tools that help us make sure we're doing a good job at a system level, at a program level, and at a staff level? And again, we've got barely an hour today to talk about all these things. We encourage you to go to the resource guide to Wraparound and read about ways to develop these kinds of program and system supports. So let's talk about accountability. What does it mean when we say that we believe that one of the 6 key themes of Wraparound system support is to ensure that a Wraparound initiative has accountability? Well, in one sentence, what we're trying to communicate here and what we think is important is that the initiative or the Wraparound community has implemented mechanisms to monitor Wraparound fidelity, to monitor service quality, to monitor outcomes, and to use these data to continually learn and assess about the quality and development of the overall Wraparound effort. That is our description in a nutshell of an accountable Wraparound initiative. So what are some big ideas about how to be an accountable Wraparound initiative, how to achieve accountability? Our sense is that there are 4 big ideas, and all of these are described on the National Wraparound Initiative website in our implementation section, and we'll show you a screenshot of where you can find that in a second. But 4 big ideas before we get into any specific measurement approaches or instruments. Let's talk about these 4 big ideas. First off, we think it's very important to establish clear outcomes. So the fact of the matter is that Wraparound communities are typically implementing Wraparound for a whole variety of different reasons. So one community may be concerned about how their resources are being spent and whether they're getting outcomes for their monetary investment. A second community might be more focused on how well service providers are meeting children and families' needs. Another community might be focused on ensuring that families are well supported by other families. So the point here around establishing clear outcomes is that rather than just measuring things that have been measured in other projects or picking evaluation instruments just off the shelf, true accountability in Wraparound requires that each community or initiative asks what the goals of their project are and how we are attempting to achieve those goals, and make sure that you're measuring things that are relevant to those things, right? So establish clear outcomes. This is a very key task of your community collaborative team, of those stakeholders who come together to oversee the overall Wraparound effort. Stakeholders should have an opportunity to work together to establish the outcomes that are important to your Wraparound initiative. The second big idea is define your process elements. So you're establishing your clear outcomes. You also need to answer the question of whether you're actually following the right implementation procedures in Wraparound. So similar to establishing your outcomes, you have to ask what your key process elements are that you want to measure. You can use Fidelity tools, or you can develop implementation tools of your own. But the most important thing here is to make sure that you have established what it is that your process elements are, what it is that your community has decided are the right implementation procedures, and then measure whether those things are happening in practice. The third thing is that we think that it's important to make sure you're actually asking individual youth and families whether they are satisfied with implementation of Wraparound and whether they're getting their needs met. So this information can be gathered through a lot of different mechanisms, written surveys, direct interviews, but it should be a part of your accountability effort. And then finally, we think that it's critical for each Wraparound initiative to ask the question of whether your investment of time, money, and other resources is worth it. There's no national standard for pricing Wraparound. What does it cost at a family level? What are caseloads? What is important is that each individual community is, in fact, measuring the costs associated with Wraparound, including the care coordination costs, the costs associated with specific services and strategies that are in the plans of care. This is something that's critical for just about every wraparound initiative that is operating out there. So there's our 4 big ideas, okay? So the other thing we wanted to cover in terms of the big ideas before we get into some specific measurement approaches is what are the implementation steps to make sure those 4 big ideas actually get executed in practice. So before making decisions on specific instruments or measurement strategies, building accountability for wraparound initiatives requires adherence to several core considerations. And again, these are described in much more detail if you go to the NWI website and go to implementation support. But again, there's 4 kind of steps that we're describing here. First off, determine how you're going to use your information before you collect it. All right? The point of data collection is not just to collect data, but actually to use it. So before you actually decide what data you're going to collect and how you're going to invest your scarce, likely accountability resources, make sure that you have an answer to the simple question of what information do we need and how will we use it? How will we actually use the data that we'll collect to make decisions? So before you just start collecting data on something that your wraparound program in a neighboring county or state has collected, ask whether or not it's appropriate for your community or for your initiative. Second implementation step is to make sure that you are being critical in your methods. So the idea here is that some projects are going to collect information just simply because it's convenient or collect data in a way that is convenient, when really what you need to do is make sure that you're collecting data in a way that's going to be reliable and valid and stand up to scrutiny. So avoid doing things like just surveying only those families who are easily reached, settling for low response rates, like, we're going to try and call all of our caregivers of youth who are enrolled in our wraparound program. But ultimately, you actually called 20 caregivers and only got a hold of 4 or 5. That's not likely to be a representative sample that you can actually base any decision making on. Another example might be relying only on the provider of a service with the responsibility for data collection. Some might argue that this is going to result in biases. So make sure you're being critical in your methods and asking whether the data you're collecting can stand up to scrutiny when you put it in front of your stakeholders or create an evaluation report that presents your findings. Third consideration, we've kind of touched on this before. This is related to the first 2 themes of making sure that your wraparound project is well supported. Stay on the collaborative course, okay? So it's important to make sure that you're including a wide range of stakeholders and a wide range of perspectives as you're building your data collection system. Some people can get very focused on single indicators that they think is representative of quality or success. It's going to be more effective, you're going to be more likely to get people on the same page, create shared meaning in your wraparound community if in fact you have a shared process, a collaborative process of defining what quality and success actually is and base your measurement strategies on that shared vision. And then finally, set reasonable goals for data collection. I'm a little bit out of order here. Make sure you're disciplined in terms of what you want to measure and make sure that adequate resources are available to collect those data in a reliable and valid way. This is related to that our admonition that you be critical in your methods there. Okay, so those are a couple of big picture ideas about what an accountable wraparound project, what kind of steps an accountable wraparound project is going to take. Now, I'm going to pause for a second. Sarah, you're going to have to remind me, possibly by jumping in, when our first poll is going to make sense to enter.
It should be right now, so I can go ahead and launch it.
All right. So, folks, this is kind of a fun thing we do with our webinars. We ask folks who are participating, and right now we've got 66 attendees. So a quick poll. We talked a little bit about the importance of 4 types of data: outcomes, implementation data, youth and family perspectives, and costs. Everyone who's participating. You can also say none of the above. What type of data does your community or project most consistently collect and use? We'd love to know. It'd be kind of fun to find out. Folks who are participating, which one of these do you think your community is best at collecting and using? Or you can always select the ever-popular none of the above. We don't effectively collect any of these things. So let's do it. Let's see what our poll results say. Do I just get out of the way, Sarah, and let people vote at this point?
Yeah, it looks like we have about 65%, 70, 75% voted. So we can give everyone a couple more seconds to answer the poll, and then we can show the results. All right, I'm going to close the poll now, and then there are the results.
All right, so what we have learned here is that relative to the other types of data, our attendees feel as though their community or wraparound project is most consistently able to collect and use outcomes data. So that's encouraging because that's the ultimate test of whether we are successful. Satisfaction data comes in second, relatively distant second, followed by process data and implementation data. And probably not surprisingly, cost data is a distant fourth. So people often reflect that it's hard to get accurate cost data and use those data. And what we have found is that in wraparound projects nationally, those projects that do have those cost data as well as the outcomes and satisfaction data are probably going to be in a good position to communicate to their stakeholders whether the project is worth keeping around. So that's something that folks are probably going to need to work on, and maybe the NWI should take this data into account as we develop things to support the field. Only 12% saying none of the above, so that's probably good. All right, so moving on. Thanks, everybody. Let's talk about types of data that get collected, and then we'll talk about some measurement options. So types of data. Waiting for it here. All right, so what types of implementation data, first off? So measuring wraparound implementation can take many forms. So one type of implementation data that can be collected is the type of data so data collection and feedback can be critical in the process of supervising and coaching staff. So one method for collecting implementation data is to have it be an active part of supervision. You can potentially roll the data that you collect up on individual staff. Questions about whether they're managing the details of wraparound implementation well. Do they have a plan of care? Does that plan of care list family needs and strengths? Are meetings involving people who are critical to the youth and family? These are the kinds of data that supervisors can collect by looking at plans of care and documentation of your staff, feeding that data back in supervision sessions, whether they're individual or group supervision. So there's a couple of resources to go to where you can talk about ways to use data in supervising and coaching staff, and those are listed here. Now, a kind of second major option for implementation data is rather than having supervisors collect the data and feed it back actively in supervision and coaching, is to have some sort of external monitoring of fidelity or implementation using tools such as wraparound fidelity tools. Now, these tools can be used in supervising wraparound staff, but they were developed primarily as evaluation measures, and more frequently they're used, the data is collected by some sort of third party, some sort of evaluator. Evaluators could be members of a family sport organization, or it could be, affiliated with a university or a quality assurance unit. But it's frequently an external check on quality and fidelity, and the data is used in aggregate form to provide feedback to the site and the supervisors and the stakeholders about how implementation is going overall. Okay? So these are two different major types of implementation data collection. Our feeling is that in terms of the type of implementation data collected, There are several different types that should be considered. And again, it should loop back to your purposes locally. 4 types of data. Data on the quality of the wraparound process. Observing teams, reviewing plans, getting feedback from youth and families, from interviews, from checklists, from surveys, are some major approaches to getting data on the quality of wraparound. A second type of implementation data that's very critical to consider is across your wraparound initiative, what are the types of services and supports that are included in your wraparound plans? Monitoring what the needs of the families are or the goals that are in the wraparound plans of care and what services and supports are being provided to try to meet those needs can be a very important thing to monitor over time. Are these services and supports actually being implemented as intended? Are the needs being met? Is there a good mix of formal services versus informal supports in wraparound plans? All of these are the types of questions you can ask of your implementation data if you systematically collect data on the services and supports that are included in the wraparound plans. Third major type of implementation data, satisfaction and buy-in among stakeholder groups, including youth and families, but also partner agencies and other stakeholders. We have some methods to do this that we'll talk about in the course of this webinar. But this is a third type of implementation data that can be very important to collect. And then finally, something that is sometimes discussed in team meetings, but the question becomes, how do you roll the data up? How do you systematically collect data about the barriers that are preventing wraparound teams from doing their work? And these could be team process barriers, such as, the child welfare caseworker is not attending our meetings, and so we can't get buy-in from that individual about our plan of care. Or it could be resource barriers. Okay, we've identified that this youth would benefit from a certain type of treatment that's specific to his mental health needs, but this treatment is not available. There's no one trained in trauma-focused cognitive behavioral therapy, for instance. Or we don't have the resource to actually enroll this youth in a vocational program that's been identified as a strategy that might meet his need. Okay, so collecting data on barriers and feeding that data back into the system such that the stakeholders, the community team can review them and ask, how can we actually try to more consistently meet these needs and address these barriers? 4 types of implementation data. What about outcomes data? All right. I warned you guys this is going to be a very broad overview here. A lot of topics. So moving quickly to outcomes data. Wraparound projects may define success in many ways. We already discussed that we need to tailor data collection to the proposed outcomes of each individual wraparound initiative. So again, critical to convene a collaborative process to define what is going to represent success for us. Make sure that the outcomes data that you collect are actually going to be relevant to your decision making. A third kind of point to be made here, outcomes should be chosen that are important to the stakeholders as well as to families. And make sure you choose data collection elements that relate to what we're actually trying to achieve so we can see whether it's actually happening. Oh, this is interesting. We seem to have come to the end of the slideshow. Oh, what did I do? I must have hit end. Hold on a second. Sorry about that, folks.
I'll fix it, Eric. Just one sec.
I hit the wrong key. This is the danger of taking the power away from Sarah in directing the webinar.
Just one second when I get back to where...
I can also just scroll back up to where I left off. Is that going to be effective? Oh, there we are. Thank you very much. So as I was saying, when we're talking about which data elements we're going to collect, in general, we want to make sure that it's related to what we actually are trying to achieve, our proposed outcomes, what represents success, and what are we actually trying to do in wraparound implementation. Do I have control back there? I'm just trying to go to the next slide here. Okay, so when you're choosing outcomes, one option is to ask about what your theory, again, of what you're trying to achieve and how you're going to get there is. So just really broadly, you can go to the Wraparound Resource Guide to see an article about the theory of change for wraparound. But this is just another way of kind of reinforcing that we need to measure what we're actually trying to achieve in terms of implementation as well as outcomes. So the theory of change for wraparound says that effective values-based teamwork is what leads to a high-quality, high-fidelity wraparound process. And then our intermediate outcomes for families is that wraparound is building family capacities, so that's something you might want to measure in your outcomes. And again, that services and supports are working better for families. So again, why you might want to measure the services that are received and whether families are truly receiving the services that are in plans might be something to measure. Through this process, we're proposing that positive child, youth, and family outcomes occur. So again, keeping our eye on what we think occurs in wraparound helps us understand what we might want to measure. So going a little bit deeper, what does high-quality wraparound actually result in? Skillful practice in wraparound is something that's grounded in strengths, driven by needs, determined by families, and actually invests in a team where accountability and results are vested. So you may very well, in your implementation data, want to focus on whether or not these four things are occurring. Are strengths being identified and used as the basis for planning? Are needs being identified and being used as the basis for strategies and plans? Are families feeling as though they own the plan? And are teams actually working well together? Again, this is just an example. Real quick, so then some ways in which skillful practice leads to intermediate outcomes for families. Services and supports working better for families. So again, we might want to measure, do services and supports match needs? Do families report that they are engaged in the process, satisfied with the process, feeling like they are in fact connected to community and natural supports? The other proposal is that participation in wraparound builds family capacities. So some outcomes you might want to monitor in your wraparound program, if you think it's relevant. Are families saying that they're coping better? Are they participating in a collaborative problem-solving effort that is working for them? And do they have optimism? Do they feel as though their strengths, that their issues are being reframed in terms of strengths and needs rather than deficits? Only then do we feel like through those pathways do we get to outcomes. High fidelity, better, more optimism on the part of families, engagement in the process, teams that are focusing on the most important needs, and so forth. And then, of course, there's our ultimate outcomes: self-efficacy, resilience, needs being met, improved quality of life, stable, safe, home-like living situations, and better functioning in school, vocation, and community. So again, our sense is that we need to be asking what we're trying to achieve before we start selecting our data collection procedures and our measures. Make sure that it's relevant to what you think you're trying to achieve for families. So having said all of that, the typical types of outcomes data that actually do get collected out there, meeting needs or goals, again, straight out of the wraparound theory of change. Increasing child and family assets, reducing the level of needs, improving caregiver well-being, increasing family and youth empowerment. And then finally, that big picture outcome that is often referenced in children's mental health and wraparound systems of care. Are we keeping youth at home, in school, and out of trouble? All right, I'm going to pause for a moment as we go in the second half of our webinar here. Sarah, are we, our next poll, is it now or is it after we get into some of the Fidelity stuff?
It is right now, so I'll go ahead and launch it.
All right, let's launch. Well, actually, why don't we hold this until we do a little bit of review of the Fidelity tools, okay?
All right.
We'll ask what they think about the capacity of their local communities to collect these data. Okay, so part 3. We've talked about some fundamental issues in being an accountable wraparound agency or initiative. We've talked about the types of implementation and outcomes data that might be collected and how you choose what you collect. Now we're going to zoom into something that NWI has been very invested in, which is developing wraparound implementation and Fidelity tools. All right. So starting off with a little bit of intro to this topic, what is it that we think leads to success in healthcare? Not just mental health care, not just wraparound, but healthcare. We think that 2 things are really critical to leading to success in our services. One is that we have knowledge of what works, evidence-based practices, some sort of research that tells us things that have been effective in meeting needs, ameliorating suffering. Once we have research and experience about what works, we then have to apply that knowledge. Research and experience provide a solution, but competence is when we apply it correctly. All right? And the role of measurement comes in that we want to make sure that we are actually collecting and organizing information about whether we are truly practicing with competence and using that information to make decisions. All right? So as we've discussed, in wraparound, what we have is knowledge that, from research, effective team processes, such as the wraparound team process, means that teams are more likely to meet their goals, and that a good value-driven wraparound process leads to outcomes because services and supports work better, and the family gains in self-efficacy, self-perceptions, and coping. So traditionally what we've done is reference the wraparound principles and how well our programs or our staff are achieving the 10 principles of wraparound. And you can go to the resource guide to read more about the principles, but my guess is most everyone on the phone has seen these and absorbed them in some way, shape, or form previously. So wraparound competence is a lot about applying the wraparound principles. What the NWI has attempted to do is to help folks recognize that we also need to have a sense of the methods through which, the activities through which we make those principles come to life in a practice model. And so when we implement the wraparound practice model, we're talking about some specific staff activities in 4 phases of wraparound. Again, we're not going to go into this currently in great detail, well, actually no detail, but you can go to the resource guide to wraparound and see the article about the phases and activities of the wraparound process to get some very specific examples of the activities that staff are asked to undertake. Now then, once you have a practice model, once you know what you're supposed to do in practice, how do you measure competence? Let's just take a look at an example from surgical safety. So in our country, 234 million operations each year, 44,000 deaths annually due to medical errors in surgery. This is more than auto accidents or breast cancer. The deaths from surgical complications result in more deaths than auto accidents or breast cancer. But the fact is that surgery complications and deaths are preventable. Just like in wraparound, we believe that positive outcomes extend from having competence in implementing those 4 phases and the activities of the wraparound practice. So in surgery, we have checklists that have been developed that are as simple as before induction of anesthesia, members of the surgical team are confirming the patient's identity, that the surgical site has been marked. Before incision, confirming that all team members have been introduced to one another by name and role, confirming that all essential imaging results are displayed in the room, and before the patient leaves the operating room, the nurse reviewing with the team that the needle, sponge, and instrument counts are complete and they're not sewn up into the patient, that the team reviews allowed key concerns for recovery and patient care. In some ways, these kinds of checks are similar to what a wraparound team needs to be checking themselves on. So for instance, before the initiation of the wraparound process, confirming that the family has been meaningfully engaged with a wraparound facilitator before the first team meeting occurs, making sure that needs have been identified, that past successes have been identified. During the course of wraparound team planning, making sure that people understand their roles, that the right people are on the team. And after a plan's been developed, making sure that the team is all on the same page about how the strategies that are in the plan of care are going to meet the needs of the youth or family. In surgery, you implement these checklists and you reduce the incidence of surgical site infection and death by half. Okay? And my sense is that we can achieve similar outcomes by making sure we're on the same page about what wraparound teams are supposed to do to achieve the principles of wraparound. What did these checklists in surgical safety accomplish? They ensured that all the members of the wraparound team have similar information about how well they're working together. It improves team communication and improves consistency of care across teams. Very similar for wraparound teams, I think, as occurs for surgical teams. Now, why would we need to have implementation quality checks in wraparound? Our sense is that from our research that we've done, there are some consistent things that wraparound teams often fail to do. And they may not have fatal implications, such as losing track of a sponge or a surgical instrument, but these can really attenuate the outcomes that we achieve in trying to build resiliency, build effective care plans for families. Studies indicate that wraparound teams often fail to incorporate full complement of individuals on the teams, engage youth in community activities and connect families to their communities, using strengths to plan services, engage natural supports, and as a team process consistently assess outcomes and satisfaction. So our sense is that we need implementation quality checks in wraparound, just like we need implementation quality checks in surgery. So what are some methods that we might use to measure implementation of wraparound? Some things you can do are have facilitators and team members fill out activity checklists. Again, this could be part of the team process. It could be part of a supervision or coaching process. Another thing we can do is look at plans of care and meeting notes and other documentation. A third thing you can do is sit in on and observe team meetings. Note whether or not the activities that should be taking place in team meetings are in fact taking place. And finally, of course, you can interview or survey the people who may know best. The parents, the caregivers, the young people, and the staff themselves about whether or not they believe that the essential ingredients of wraparound are actually being implemented as intended. So in order to interact with the fact that we have all these different options for collecting fidelity or implementation data, we've developed a number of tools that you can go learn more about by going to rapinfo.org or our homepage that you'll get directed to by clicking on the appropriate icon at rapinfo.org, which is listed here. This is our website at the University of Washington. But we've developed 4 measures that we think can be helpful to folks if they feel as though implementation data is something that they will benefit from in their wraparound initiative. These 4 instruments collect data using those very types of methods that were just reviewed. So we have the Wraparound Fidelity Index, which uses interviews with folks who are involved in the wraparound implementation effort. We have a team observation measure. We have a document review measure. And we have the community supports for wraparound inventory, which gets at the system-level support issues by talking to stakeholders. So really quick, a lot of folks may already know about these, but we have the WFI, the Wraparound Fidelity Index, which assesses implementation of wraparound through interviews with caregivers, youth, facilitators, and team members. Possesses good psychometric characteristics. We've found it, as we'll see in a second, to be related to outcomes. And has been used in research on wraparound and increasingly as a quality assurance and evaluation mechanism. So some examples of some of the questions or some of the items that are in the WFI interviews. we organize the items of the WFI in a way that goes along with the idea of the 4 phases of wraparound. So we have 40 items, takes about half an hour, 20 minutes to half an hour. Sometimes it might take a little longer, or it might take a little less time to administer depending on how chatty your interviewee is. But we have 40 items that take the form of things like this one. In the engagement phase or the engagement section of the interview, we ask, at the beginning of the wraparound process, did you have a chance to tell your wraparound facilitator what things have worked in the past for your child and family? Okay, so it's pinned to the engagement phase of the process and also to the idea of building on strengths. So that item is related to the principle of strengths-based as well as provides information about the engagement phase. Second example here in the interview, does the plan include strategies for helping your child get involved with activities in the community? That's related to the planning phase of wraparound and the principle of wraparound being community-based and connecting youth and families with their communities. Third example, does the team evaluate progress towards goals or towards meeting needs at every team meeting? This is linked to the principle of outcomes-based and is part of the section of the WFI that is asking about the implementation phase of wraparound. And then final example, will some members of your team be there to support you when formal wraparound is complete? It's part of the transition phase assessment of the WFI and is pinned to the principle of unconditional care. So the way that the WFI works is that an interviewer is trained to criteria using a training toolkit to administer the interview almost as though they're just having a conversation about the youth, the caregiver, or the facilitator's experiences with a specific wraparound team. And here are examples of all 6 items from the engagement phase of the WFI interview. You have a conversation about how the process of wraparound worked for your family before your first team meeting ever occurred. What was it like when you first started the wraparound process? How did you first meet your facilitator? The interviewer asks that kind of general prompt, gets information from the interviewee, and then completes the items as they get information about each of the items in that section of the interview, and completes the WFI as they proceed through the interview using the scoring rules in the WFI manual. Really whizzing through this here, but at the end of having collected a number of data points using the WFI, having completed a number of interviews, there's a number of reports that you can get. So what we see here is an example of total scores that can be yielded from collecting data using the WFI. So in this hypothetical site, we have 37 youth who are assessed through wraparound facilitator interviews, caregiver interviews, and youth interviews. And what we have here is the national mean or the national average for each of these 3 types of interviews, the interviews with the facilitator, the caregiver, and the youth. You can see that even though the items are the same, the average score nationally for the facilitators is higher than the average score that's obtained from caregivers. So 83% of the total possible fidelity score is what is average for facilitators versus 75% for caregivers. So caregivers are a little bit more critical of what they received than facilitators are about what they delivered. And youth are even more critical still, with their average score on all of the items of the WFI being only 73% of total possible. Now for this site, you can see their scores being 80% for the facilitator, 73% for the caregiver, and 68% for the youth. So the feedback that we have here is that overall this site is achieving a level of fidelity that is lower than average for wraparound initiatives across the country. We've also conducted research that suggests some benchmarks for what these scores mean. So when you combine the three types of information from facilitators, caregivers, and youth, we wind up with a combined WFI score of 75. 75, from our research, is right on the line between borderline and adequate level of fidelity. So the question for this site will be, what can we do to improve our overall wraparound implementation effort so that we can get well into the adequate fidelity range and into the high fidelity range that's been found to be associated with the most positive outcomes from wraparound initiatives? Well, how can you use the data to actually make those kinds of improvements? One way to do that is to really dig into the individual item scores that have been that result from the interviews. So you can actually ask, what number of families that we talked to told us that they were, in fact, able to tell their wraparound facilitator what's worked in the past for their child and family. So that could be something that's injected into planning. In this site, this is only true for about half of the respondents, only true for 7. It was partly true for 4, not true for another 4. So some specific areas of feedback for quality improvement can really be can be gained by looking at the individual items and the individual item scores of the WFI. And this is another type of report that results from using the WFI. All right. Only got a few more minutes before we want to get into conversation about using tools and collecting data. So let's look at our other couple of fidelity tools here. The team observation measure is another instrument in the wraparound fidelity assessment system. It's used by external evaluators, although it's also been used by supervisors to assess adherence to standards of high-quality wraparound during team meeting sessions. And the TOM consists of 20 items, with 2 items dedicated to each of the 10 principles of wraparound. And each item consists of 3 to 5 indicators of high-quality wraparound practice, as expressed during a child and family team meeting. And psychometrics have been found to be very good, and we found that the TOM correlates well with WFI scores, which is a good indicator of concurrent validity. So here's some examples of what you can get from TOM data. In this hypothetical site, the most frequently observed TOM indicators, so like I said, there's 20 items on the team observation measure, each of which has 3 to 5 indicators, so there's a total of 71 indicators. A trained observer collects data using, again, a manual with scoring rules that assesses whether or not indicators such as these happened or did not happen during the team meeting that they observe. So for instance, the parent or caregiver is a team member and present. In this site, this occurred 92% of the time, or in 92% of the team meetings that were observed. Is there a written agenda or outline for the meeting? This is a strength of this site. This is happening 9 times out of 10. Is talk well distributed across team members, with each team member making an extended or important contribution? This is not something that always happens very consistently in wraparound teams, but in this site, this is a strength. It's happening 89% of the time. Some other examples of indicators that were not happening so frequently in this hypothetical site. The strategies that are being designed in the meeting. Are team members considering and building on strengths? Happening barely more than a quarter of the time. Is the team assessing goals and strategies using measures of progress? This is supposed to be part and parcel of the wraparound team process. Happening only 26% of the time. The facilitator leading a robust brainstorming process to develop multiple options to meet needs, not happening consistently. Community team members and natural supports having a clear role, not happening consistently. And then the indicator that is happening the least often, only 1 out of every 10 or 1 out of every 9 team meetings that were observed in this site, that key natural supports for the family are team members and present, something that's very difficult to occur or to achieve nationally, we have found. If you feed data back into the system that illuminates just how infrequently it occurs, this is the kind of information that we think can be used to, in a systematic process of improving the functioning of the wraparound teams. The last measure of our individual fidelity measures is a document review measure. We're currently revising this tool. It consists of 20 items, and it allows a trained reviewer of the paperwork of wraparound to take source material such as wraparound plans of care, crisis plans, progress notes, strength need, culture discovery documentation, whatever is collected in a local site, and assign scores on a scale of 0 to 4 to 20 items about whether, again, core aspects of the wraparound model are being observed to be achieved in the course of implementation, as evidenced by the documentation that is available. All right, so now maybe we will pause and go ahead and do that second poll, Sarah. We're almost to the end of our didactic here. We started to administer this poll. The question is, what do you think would be the biggest barrier to collecting this kind of implementation or fidelity data? Do we think that do you think that your biggest barrier might be having staff or resources to collect the data? Would it be that you have a lack of expertise or personnel to analyze the data and do reports? Would it be a barrier that you don't have a community collaborative body that might actually, or some entity that might actually review the data and act on it? Do you think all of the above would be a problem, or do you think none of the above would be a problem? Just a little kind of taking the temperature of folks out there.
Eric, I think that since we had to close the poll, that we're not going to be able to launch this one, unfortunately.
Really, we can't relaunch it, huh?
I can't see how to do that quickly.
Oh, well, that's the way it goes. Well, something to consider among yourselves there at home or in your offices. All right, so let's talk real quick about why we think it's important to collect these implementation and fidelity data. In a nutshell, what we found in our research is that families who experience better outcomes have staff who score higher on fidelity tools. So staff who are implementing wraparound in a way that is measurably adhering to the principles and the practice model using our fidelity tools have also been found to have to be serving families who are experiencing better outcomes. At another level, at a wraparound program level, wraparound programs or initiatives who on average or overall have more positive fidelity assessments have also been found to demonstrate more positive outcomes. And this reinforces the reason to collect fidelity data and also provides support for the validity of our fidelity data. Here is just one example of one of these studies, a very recently presented study from Indiana, and our colleagues Vicki Eflin, Janet McIntyre, and Betty Walton in Indiana. They have been collecting wraparound fidelity index data using our interviews, as well as outcomes data from the Child and Adolescent Needs and Strengths tool, John Lyon's outcome measure for children's mental health. And what they found is that the families who experienced a high fidelity wraparound process, so again, looking at our benchmarks, fidelity that was above 85% of the total possible, 82% of families who experienced a measured high fidelity wraparound process showed reliable improvement on the CANs. By contrast, families whose wraparound fidelity index data indicated that they were getting something that did not look much like wraparound, so less than 65% of the total possible fidelity score, only 55% of those families showed reliable improvement on the CANs. We don't see a direct one-to-one relationship between fidelity and outcomes by any means. Certainly a good half of these families or these youth are showing improvement. But the trend is clear that if we push towards higher fidelity practice, we are more likely to have measurably improved outcomes for youth. So what does it take to get these high fidelity scores? This goes back to the webinar that was conducted last, I guess it was in April, by Marlene Matarese and Mary Jo Myers, and that will be presented later this month with Michelle Zabel from the Innovations Institute of Maryland and Bruce Camrat from Wraparound Milwaukee. That you need a wraparound initiative needs to have good support for the wraparound effort, part of which is providing good training and coaching for staff. Both of these things have been associated with higher fidelity scores. So as one example, we conducted a study in Nevada that assessed wraparound fidelity over time as this system of care attempted to implement wraparound in the absence of any systematic training, after the initiation of training, after the introduction of coaching that was data-driven. You can see that as this greater investment of workforce development effort was obtained in Nevada, that wraparound fidelity scores went up and got into the high fidelity range that has been found to be associated with the best outcomes among programs that are in this range. Now what's interesting is that you can actually backslide. So after this system of care went to scale statewide and a number of resources were lost, we found that the fidelity went back down. So this is a lesson to us about the importance of investing in the human resource development and support of our staff in order to achieve higher fidelity. Got to look back to our program and system supports for wraparound. Here it is right here, human resource development. But we also need to make sure, again, that our service array is of high quality and accessible to teams, that our fiscal policies are in alignment, and that we've got good community partnership and collaborative action. Communities that achieve these kinds of conditions have been measurably found to achieve higher fidelity out there. So in summary, not just talking about measurement and accountability, but the why of why are we actually collecting these data? Why are we actually doing training, coaching, and quality assurance? Why are we trying to make sure that our wraparound initiative is living up to those 6 types of system supports? Because we find that those types of investments lead to better adherence to wraparound principles and service delivery, better fidelity, and better fidelity, you know, again, hardly a one-to-one relationship, but in general, the trend is towards better child and family outcomes. So again, make sure that in your wraparound initiative, you're defining what you want to know based on what you're trying to achieve and how you're trying to achieve it. Define the data sources that will get you the information that you need to assess whether you're achieving those outcomes and achieving that high-quality implementation. Do those data already exist? Can you find it in plans of care? Can you find it in supervision documentation? Is there administrative data that you can rely on? If not, then you ask, what do you need to collect? Don't just jump to a fidelity tool or an outcome measure because somebody else is doing it. Make sure it relates to what you want to know and the types of decisions that you're going to need to make in your community over time. And then, of course, once you've got to that point, you've got to make sure the data gets used. Establish a process for reviewing the data, establish your protocol for decision making, and make sure that data is used to inform action. Make sure that the data is the kind of data that can actually help inform you whether you need to stop doing something that you're doing that's providing a barrier, whether you need to start doing something like do more active coaching to facilitators to achieve better implementation. Do you need to start doing family finding to get more natural supports involved? Use the data to inform action like getting additional resources. So can you make the case that that additional resources are needed for some of those things, or make the case that systems need to start working together better. Perhaps the child welfare caseworker supervisors need to be instructing their staff that they need to participate on teams and so forth. Make sure the data is actually informing action. So we are at the end of the didactic section of or piece of this webinar. just a couple last things. You can go to the Wraparound Evaluation and Research Team page to learn more about the implementation measures and the fidelity measures we just described at rapinfo.org. Those sites that do sign up for using any of our tools have access to online data entry and reporting systems that allow users to enter data via a web portal. It compiles the data and creates a range of reports that can be useful. So here's just a few screenshots of the Wraparound online data entry and reporting system that we affectionately call WONDERS. Again, data entry. There's some examples here, a screenshot of the reporting page where you can pick the reports that you would like to produce. And here's an example of how you can generate reports that compare different sites within your initiative. It always provides the benchmark of the national mean on the instrument that you're reporting. And some other resources and websites that will be available if you go to the National Wraparound Initiative website. I am losing my voice at this point, so I'm going to stop and take a look and see if we have any questions. How are we doing, Sarah? Do we have any questions out there, and how can we view them?
We do have some questions. Would you like me to just read them off to you, Eric?
Well, I'm looking here at questions. I'm not able to really see it. It's almost like it's a tiny little, oh, I can blow it up here maybe. No, let's see. I see a question that says, what is the difference between evidence-based practice and practice-based evidence? Is that the example of the first question that we have here?
Yep.
Okay. Well, I think that was kind of part of the narrative of this didactic as an example of, or as two examples of how we get information that about what works. So remember that the two pieces of high-quality healthcare are knowledge and competence. So practice-based evidence and evidence-based practice are just what we're relying on for the knowledge part of that dyad. Evidence-based practice typically defined as procedures, treatments, or strategies that have support from some sort of rigorous research that there's evidence for its effectiveness. So research-based practices from formal research, practice-based evidence being the flip side of that, which is that programs or providers having a good track record in their community with implementing some sort of treatment, some sort of procedure that may not be the focus of formal research, but for which there is confidence among those who have been implementing that practice that they have observed it anecdotally to have generated positive outcomes for the individuals that it's being used for. So practice-based evidence is something more that is less based on formal research and more on the experiences of providers in the community who have found something to be effective from their own perspectives. Typically, what we ask is that practices that have that kind of anecdotal, bottom-up sense of effectiveness that have not been tested through formal research, that then the next step is to say, we would like to kind of confirm what individuals in this community have found about the effectiveness of this practice and subject it to some sort of more formal research agenda. So basically that's just a point that was being made about how do we generate information about what works before we ask, are we competent at implementing that practice? I don't know if I answered that very effectively, but that's a little bit about EBPs versus practice-based evidence.
We've got a couple hands raised, Eric. Do you want to have some verbal questions?
Sure. Let's hear some interaction from some real people out there.
Okay, so we have a question from Pierce Charles. Pierce, are you there?
It's like talk radio.
I know. Can you hear us, Pierce? I've unmuted your line so you can ask the question. All right, it looks like Pierce isn't there, so we've got another hand raised, though, from Joyce Cosby. Joyce, do you have a question?
Yes, I.
Oh, I heard you for a second, but...
Are you there, Joyce?
Can't...
Well, I think we're having some technological breakdowns here, Sarah.
I think so.
You didn't accidentally mute her again or anything, did you?
No, she's unmuted. So
Okay.
I guess
right.
We'll just go to the next typed question.
All right. What do we got here? I think I read here, how do you frame this work/outcomes that makes it appealing to grant funders who see language such as strength-based, family goals, etc. as touchy-feely language? Well, that's a good question. So certainly when you start getting down to some of these types of data elements that might be part of your accountability procedures, they're not really very touchy-feely at all. So some of the examples here are costs and outcomes like keeping kids out of trouble. It's hard to imagine that people would find those very touchy-feely. The short answer to your question is that if you've got stakeholders who are not going to be responsive to touchy-feely types of data that are related to families feeling engaged or families feeling more optimistic or teams being collaborative or other types of touchy-feely data like that, then you locally need to interact with that reality. If your information need is to convince people about harder outcomes like we are keeping this program cost neutral because we're keeping kids out of residential treatment, you need to collect data about how you're keeping kids out of residential treatment. If it's people who are looking, if a core stakeholder group or funder is providing you with resources because they think that the wraparound program is going to get kids to permanency faster or keep them from recidivating in the juvenile justice system, then those are the data you need to collect. Now you may at the same time have other stakeholders who are going to need to ask whether or not the way that you're achieving those outcomes, such as implementing the wraparound process with Fidelity, and the touchy-feely aspects of wraparound Fidelity that are inherent there about asking families what's worked for them, whether they feel like they're being heard, whether they feel like they own their plan. If those are the ways that you're trying to achieve those outcomes, then it may very well be that you've got other stakeholders who are going to use those data. But if you've got stakeholders who are going to respond to the harder outcomes and the harder data, then you need to interact with that need and make sure it's part of your data collection process. That's kind of the short answer there. The other thing you can do with some of the Fidelity and implementation data is to show them the evidence that if you do, in fact, have better plans, families who are more engaged, families who are feeling more optimistic, the research shows that those are going to be families who also are able to care for their kids in their own homes rather than relinquish custody or feel as though they are not able to care for their children in the context of their own homes, which may very well lead to some of those negative outcomes. Kids who are not supervised and who get in trouble, kids whose mental health problems are leading to them having to experience a stay in a more expensive out-of-home placement. So the other way to deal with this is to say, we realize that it may be kind of abstract to say that because we got 85% of total possible fidelity, that that's a really positive outcome. But here's the research that shows that kind of fidelity is associated with more improvement in emotional behavioral problems, less placement in out-of-home placements, and those are outcomes that we're all invested in. So we think it's important that we have a wraparound program that's achieving this level of fidelity. What else we got here, Sarah? We got a question that said, are there specific lessons that can be learned from Nevada's experience in terms of sustaining high fidelity on a statewide level? Yes, well, specific lessons that can be learned from Nevada. I don't want to call Nevada out too much because those folks are trying very hard to do something that not many states have done, which is to take a small pilot program that was well supported for a small number of kids. They got great fidelity, they got great outcomes, and then they tried to take it from 30 or so children and youth to going statewide and implementing it for 500 or 600 youth. This is a challenging endeavor with any kind of evidence-based practice. My observation is that to some extent, secular trends really hurt the effort, which is that the economy in Nevada collapsed shortly after they went to scale. Budget cuts were incurred. Systems were not paying attention to the program as much as their own survival. So, you know, there are certain things that are always going to be out of control, out of the control of the individuals who are trying to support any sort of EBP effort, and this was no exception. That having been said, the essential question for any initiative that's going to scale like this is how do we actually do our best to maintain implementation fidelity and avoid drift from fidelity. And I think the central lesson is that you need to make sure that you're keeping you're assuring that resources are continuing to be available even when you go from 4 care managers or facilitators to 30, that you still have a process of training them consistently, supervising them to do the practice model using some sort of specific supervision approach that involves looking at data of the quality of the practice. You need to be monitoring the outcomes that are being achieved for each individual team and use that data in the team process. You need to figure out how to commit to what may be much more complicated when you go to a big scale-up effort. Make sure that those procedures for supporting the workforce to do high-quality practice are well thought out and in place before you actually do go to scale. Don't leave that stuff to chance, because the experiences from many evidence-based practices are very consistent. You are unlikely to achieve success without having those technologies built into your process. Consistent training, some sort of approach to coaching and supervising staff in an ongoing fashion are going to be critical. And there are a whole bunch of other system issues that relate to those 6 themes of community support. So again, it's going back to this slide back up here, which is, you know, if the question is what are the lessons learned, it comes back to this, right back to this: training, coaching, and quality assurance, and program and system supports. That's going to keep you from experiencing drift and potentially will ensure that you're getting better child and family outcomes. So let's see, what else we got here? Did Wonders produce the charts as well as the national means? So April Sather is with us. She's the coordinator of the Wraparound Evaluation and Research team and oversees Wonders. I don't know if she can be unmuted to chime in there, but I believe that what happens is that we are consistently monitoring what the national means are and program the reporting feature in Wonders to provide the relevant data about the national means. I don't think it's continuously updated, but it is from all the national data that we do collect through Wonders. Is that correct, April?
Yeah, we've established the national means based on data that we collected, and we keep that number set. It doesn't flux with the data that's input into Wonders.
Right, so we have to periodically update those national means. But now that we've got over 3,000 Wraparound Fidelity Index administrations in our data set, those means don't change. They're not very volatile. So we check in, run reports for the entire national data set periodically, and then update the national means that are provided on the reports as benchmarks.
And I think the other question, Eric, was if a lot of the graphs you used was produced in Wonders, and I'm guessing maybe some were and some were probably manipulated by us.
Right. So the ones that were produced, so the ones that I showed earlier on are kind of a little prettier than the ones that are created automatically through Wonders. This is an example of an actual Wonders report, right, April?
Yes, that's right.
So this is report 8 out of the 13 that are available for the WFI, and this is showing the the fidelity scores by the 4 phases of wraparound for 2 hypothetical supervisors within one site. So the red bar is the site overall, and the green and the blue bar. I don't know. I'm kind of curious who Ingrid Sadler Walker and Dee Booth are. April, we'll have to talk about that at some point. But this is just an example directly from Wonders.
And I'll say that you can produce these reports and you can print them and save them and further kind of manipulate them yourselves as well.
Right, and you can also export the data for your own use. Those of you who are out there who've used Wonders know that the vast amounts of data and the rapid accumulation of folks using the tools in Wonders has caused some problems, including some timeout problems in exporting and running reports. We're trying to make sure that that is no longer an issue and hope to have that taken care of very soon. We didn't realize just how much demand there would be and what the implications would be for our server speed and so forth. So we're trying to deal with these things as we go forward. So any hands up there, Sarah, or are we out of questions?
Yeah, I don't see any hands. I think we have answered all of the typed in questions. So unless anyone else has any, oh, we just got another one in.
Another question.
Yep, another question. Let's see. So do you find that when a program works on a small scale, the trade-off to take it to a larger scale will keep it from being successful? Pilot programs seem to work because there is an incentive for them to work and often enough money to implement them, staff that is invested, etc. Do you think the translation to a larger system actually makes it harder to implement, especially when we are talking about what amounts to a big change in mindset from what people are used to a wraparound system of care?
Well, it's a very good segue to our next webinar, which is on June 29th. We're going to have Bruce Camrat from Wraparound Milwaukee and Michelle Zabel from the state of Maryland talk about how to support a care management model that has the capacity to serve many families using the wraparound process. So I think that the short answer is yes, it can be more challenging. It can also be something that's, that makes the entire effort much more successful. If you are in fact going county-wide or statewide and in fact getting investment from multiple systems, you may very well find you get to the level of investment by the child-serving systems that allows you to serve kids more effectively because you have more systems on board. At the same time, you have to manage the details of how you're going to support 30, 40, 50, 100 wraparound facilitators instead of 3 or 4. So again, it all comes down to, regardless of what the scale is that you're working at, whether you are in fact achieving those 6 themes of wraparound support. Again, regardless of the scale, are people bought in? Are they working together to blend resources and oversee the effort? Is the financing model going to work, which is what they're going to talk a lot about in 2 weeks? Is there accountability? Do we have a service array that's well organized and accessible? And again, is the human resource support there? Whether it's 3 facilitators or 30, whether it's 1 family partner or 100, the challenge is to develop strategies that can achieve those 6 types of system supports. I do think it's always going to be difficult to take something to scale initially, but with adequate planning, we've seen great success out there in statewide wraparound initiatives and countywide wraparound initiatives like Wraparound Milwaukee. So because we're kind of out of time, and that's a big question, maybe defer it to some of the materials that are in the resource guide to Wraparound that talk about ways that people have implemented Wraparound in big jurisdictions, and or tune in 2 weeks, June 29th, at 11 a.m. Pacific, 2 p.m. Eastern, I believe, for Bruce Camrat and Michelle Zabel. We'll be talking more about that.
All right, so should I close the webinar?
I think that we're done. And again, thanks to everyone for tuning in, so to speak. This was a lot of information. Like I said, I'm hoarse. I'm putting a lozenge in my mouth right now. I hope that that wasn't overwhelming, and I hope that it was helpful. But one of the key messages is if you would like more details, there's a number of resources that we've referenced and put into PowerPoint that you can go to learn more. So thanks, everybody.
Thanks.